Hi guys, I'm Desai Reluya. So, welcome back to my channel. Today guys, I'm going to share to you guys yung naging experience ko during COVID-19 days dito po sa aking work, especially in the nursing homes. But before that, I'm going to say thank you po sa lahat ng mga frontliners. Especially sa mga nursing homes namin, housekeeping, CNAs, nurses, department heads, laundry, kitchen, therapists, doctors, lahat po ng mga tumutulong. You guys are all amazing frontliners to help our residents. So, it was around March po na nag-start ito sa US na may mga madadami ng case ng COVID-19 in which ang ginagawa po namin in the nursing homes is nila-lockdown po lahat ng nursing homes. So, nakaiyak, joke. So, wala pong family, anybody are not allowed to go inside except po for the regular workers. So, starting March, we don't allow other vendors, kahit sino, kahit mga doctors are not allowed to go inside the nursing homes. So, ang pwede lang pong pumapasok sa nursing homes are the regular employees, yung mga na-mention ko kanina, na mga frontliners na sinasabi ko inside the nursing homes, na bumubuo ng nursing homes. Families, wala lahat po, as in nobody. So, during those times, March, April, May, around that area, June, as in, sobrang quiet po ang buong mga daan. Kasi, ano lang po talaga, frontliners, groceries yung lang open, mga drugstores, and sobrang daming cases po talaga ng COVID-19 in the US. So, during this time, starting March, we have a list po ng mga regular employees inside the nursing homes of kung sino lang yung allowed to get inside the nursing homes. So, upon getting inside, may taga-check po ng temperature, just making sure. So, every nursing home has different policy. So, others, 99 above, hindi na pwede. Yung iba naman is 100. So, depending on their policy. Basta po, pag hindi po kayo pumasok doon sa temperature ng policy nila, is alis po kayo. I mean, you cannot go inside. So, ang gagawin mo is magpa-test ka ng COVID-19. If you're positive, then you have to stay at home for 2 weeks. And then, you are only allowed to go back to work if you have 2 negative results that has 24 hours in between those first and second test. If negative ka naman, I think dalawa nga ang hinahanap. O positive ka, then you have to stay at home. If mild symptoms lang meron ikaw, pero if wala, if severe, then that's when you have to go to the hospital kasi sa dami-dami po ng mga patients na kinikater nila during this times. Hindi na po nakikater yung mga may mild lang na mga symptoms. So, during those times, yun po yung ginagawa namin. So, papasok tayo inside the nursing home. So, we were able to get inside dahil okay yung temperature natin. We have to sign up paperwork that says that we don't have any symptoms of COVID-19 and that hindi tayo umalis ng bansa, hindi tayo pumuntang ibang country or hindi tayo pumuntang ibang states in the last 14 hours that has higher case of COVID-19. So, pagkapasok po natin this is in our case po as therapist, pasok kami sa rehab gym, everything, so settle muna, and then, before po kami papasok, since during these times, meron kaming time talaga na lahat ng patient namin, in our caseloads, are all positive talaga, and the only one that's not positive is the one who recovers from the COVID-19, so as in, like everybody in our list, are all positive. So, yun po, dapat before kami papasok sa bedroom ng mga patient, dapat naka-full gear kami, meaning, head cover, check, gown, aside from our scrubs, sometimes bumibili din kami ng sarili naming washable gowns, and then the nursing home would always provide us gowns like everyday talaga, na the ones that we can just take off pagkatapos. And then, head cover gown, foot cover, goggles, face shield, mask, N95, K95, surgical mask, gloves, everything. So, lahat po yan, naka-full gear kami before papasok. So, pagpasok naman po namin inside the bedroom ng positive patient, naka-full gear na kami. Tapos, makikita mo doon sa loob, meron yan silang dalawang parang cart that says trash and linens. So, doon namin ilalagay kung washable ang mga gamit namin sa linens and kung trash, doon na lahat. So, yung mga disposable gowns, pagpasok namin, since naka-gown naman kami ng disposable, pasok ka doon sa patient, okay, pagkatapos ng pasyente, before kami lalabas ng bedroom sa mga patient, we have to take out the disposable ones and put it in the trash. And tapos lahat ng mga gamit namin, tinitake off namin except for the washable gowns na gamit-gamit namin. And then as much as possible po, inuuna po namin yung mga negative patients first and then positive. So, pagkatapos po noon, tsaka pa kami makahinga pagkadating namin sa gym kasi we don't bring residents inside the gym. Doon lang po namin talaga tinitreat lahat sa bedroom. Even the negative. So, nobody will stay in the dining area. Everyone is inside their bedroom. Kumakain lang sila inside the bedrooms. Everybody, as in talaga, sobrang quiet ng nursing homes during those times. And, that was around March, and then April, I think that was April when we started having our COVID test every week. At first, sobrang sakit po talaga, and then it was so scary. Like, we feel like we wanted to take day off na lang, but then we cannot because hindi nga allowed papasok yung ibang therapist from other buildings because kung sino lang yung regular na employees in that nursing home are the ones who are allowed to go inside that nursing home. So, sobrang hirap. So, but then, we're able to make it naman. So, May, June, July area, parang nag-low na yung case ng COVID-19 during this times. And then, during around August, September, wala na masyadong case, as in 0 case na talaga. So, ang the ones that we have right now are PUMs and PUIs na lang. So, if you're from the hospital, pag galing kang nursing home na hospital, kapag balik mo, automatic PUM ka. So, you have to be in isolation for 14 days. Regardless kung if you have the symptoms or not, isolation talaga. And then, even if you only have appointment outside, as long as sa labas ka the nursing home, as long as bibisita ka, umuwi ka sa bahay nyo, sa panahon ngayon ha, uwi ka lang sa brother mo or parents mo, pagbalik mo in the nursing home, automatic isolation po talaga. All staffs, residents, we have scheduled na talaga COVID testing. Sa mga staff kami, we got tested every week, every nursing home. But then since I have 2 buildings, bukas is going to be my 35th pang 35 test ko na po. So the first few tests is super masakit, but then later on they changed na the way on how to do the COVID testing. So right now is nasopharyngeal na test na ang ginagawa namin. Sometimes yung mga from IDPH talaga na mga employees yung kumukuha ng COVID test sa amin. So, and then right now, since medyo nag-low na talaga yung case ng COVID-19 in the US, the only thing na pwedeng allowed in the nursing home are, pwede na yung mga doctors, mga podiatrists na papasok, but rest assured, at ibang therapist, but rest assured, they have the negative result that prior week. And then, pag papasok sila for the next week, another testing. So, there's always like, testing every time. So, yun yung mga naging, experience namin with COVID-19. And, so right now, according to statistics naman, sa buong US, we have 7.2 million confirmed case. Deaths are 208,118. Recovered is 3.8,063,073. With the global naman, this is as of September 28. 33.1 million yung confirmed case natin. Ang death is 998,674. Recovered is 22.9 million. Yung sobrang madami ang naka-recover. Madami din yung mga nawala sa atin. And then, I know guys na alam nyo na yung mga symptoms with COVID-19. So, pag mild lang, since dito nga, we have a lot of cases, we just have to stay at home. But then, rest assured naman na yung nag-positive at home would always just stay at home. As much as possible, they would just order food from outside. And then, kasi nga, they're not allowed to go to the hospital pag hindi severe. But then, you always have to check, make sure to always check yourself, temperature, oxygen level, blood pressure, because one of the symptoms of COVID-19 is hypoxia, in which your oxygen would just drop down, which you didn't even know. So parang mawalan ka na lang ng hangin of your lungs. So ang mga emergency warning signs, we have to make sure na if you have trouble breathing, chest pain, confusion, and inability to wake or stay awake, or may bluish lips or face, yun yung mga severe na dapat ka nang pumunta sa emergency. Ang mga non-severe naman, ang mild is syempre fever, dry cough, fatigue, shortness of breath, muscle, body aches, headache, loss of taste or smell, which ito yung sobrang dami na feel dito sa Chicago, yung loss of taste and fever, I think, nausea and diarrhea. So, the very, lang po talaga, yung very learning lang po natin with COVID-19, with my personal experience po, yung wearing mask, staying 6 feet physical contact talaga, it really helps. Kasi the virus will just die kung walang carrier. So, kung wala siyang madapuan, so, mamamatay siya. So, if you're positive, tas you just stay in the bedroom, then it will just die in there. Basta make sure wala kang contact 6 feet. And then, face shield. So, right now in the nursing home, since konti na lang yung cases namin, ang ginagawa namin, we have make sure we are still using the KN95 mask, face shield. Siyempre, tine-check pa din and weekly testing for sure. Pag hindi kami pumapasok, if we are just walking around the building, pag hindi kami pumapasok sa mga PUI, pa with PUMs and PUI, syempre, full gear pa din kami. So, yun lang yung pinaka-importante talaga is wear mask, face shield, wash hands is very important, and 6 feet apart. So, guys, sa mga nag-positive, sa mga nag-positive, huwag masyadong ma-stress, especially pag mild symptoms. Okay na yan kasi kesa naman yung sa mga severe. And sa mga hindi pa naka-experience or nang wala pang kilalang naging positive patient ng COVID-19, walang friends or family, please guys, don't bash the people that has contact nga lang with the positive person, because kasi hindi naman po lahat na dadapuhan ng virus. We have a lot of experience na same bedroom, same kumakain, as in magkatabi, they have same symptoms na mild fever. Nung nagpa-test naman, the other one is positive and the other one is negative. So, nagpa-retest ulit. The other one is positive talaga and the other one is negative. So, we just make sure na i-boost natin yung immune system. So, vitamin C is very important. Kain tayo ng mabuti, matulog ng maaga. Huwag masyadong magpa-stress po talaga. Yun lang talaga. Huwag masyadong mapraning with COVID-19. It's there. The virus is there. Like, na kikita talaga namin, like, kung paano yung mga residents or mga patients na who has it compared to sa mga fever lang or flu lang, diba? Iba talaga with COVID-19. They're super duper weak and they need oxygen talaga yung mga iba. And, lang po talaga, wag pong i-bash yung mga nag-positive or yung mga may contact with the positive. Kasi, super hirap na po sa feeling nila na they got in contact with the person with the positive, which the positive doesn't even know na she has it or he has it. So, wag po nating i-bash. We have to pray, and then the very good thing na pwede nyong gawin is to wear masks, stay 6 feet apart, wash your hands, eat, tulog, drink vitamin C. That's it po. Wag po nating i-bash. And stop, sharing those names in the groups kasi po, kawawa po sila. Tsaka, yun lang. Stay away from people muna, especially sa public places. Make sure you have your mask on. Yun lang po talaga. I hope you're gonna like my video. If you have questions, dito lang po, comment down. Thank you!